Hey guys, in this video, I'm going to talk about our knee anatomy. Welcome back to my channel. This is Elbu, your exercise physiologist. I'm just gonna keep this simple, go through what are the things that you'll find around our knee joint. Okay, so mainly 4 bones, couple of ligaments, and then the muscles. Okay, so let's get started. I'll show you the diagram so you can you can actually look at it and have a good picture of how the knee joint looks like, right? All right, so over here we have our knee joint. Okay, like I said, 4 bones, right? So this is your femur. All right, second one, your patella. Okay, and then this is your tibia, and then your fibula, right? So when we look at the knee joint, these are the bone structure that is considered knee joint, but I'm just going to focus more on 3 bones because the other one is kind of like just happen to be nearby. Okay, and that's the fibular bone. Okay, when we look at the joint itself, it doesn't much get involved that much, right, when our knee is moving around. Okay, so the other thing that you want to take note of is that your kneecap is actually like a floating bone. Okay, it's not fused. It's just a piece of bone that's floating around. If you have been playing around with your knee joint, you realize that when you're relaxed, there's a portion of your knee that can be moved around. That's actually your kneecap. That's your patellar bone, right? And so let me introduce more structures. Okay, so from here you have your meniscus. Okay, this whitish thing over here is basically your meniscus, and it sits nicely in between your femur bone and your tibia bone. Okay, so then let's take a look at the back. Okay, we have our ACL ligament. Okay, which is commonly spoke about because people has been tearing their ACL more often than other ligaments, right? So this is the one. Okay, and then you have a ligament that holds your femur bone with your fibular bone. Okay, this one over here. All right, so you see it's just trying to hold it there. Okay, and then some more ligaments coming in. Okay, so over here, right, this other ligament is your PCL. All right, your posterior cruciate ligament. Okay, so let's talk a little bit about these 2 ligaments, right? Basically, these 2 ligaments, okay, it's there to hold both your femur and your tibia bone together. All right, so when you have your knee this way, all right, one ligament is preventing your knee joint from, so okay, this is your femur, this is your tibular bone. Okay, right, so when they're here together, right, one is preventing it from moving forward this way, one is preventing it from moving backwards this way. Okay, so when you land in a very awkward position, this sometimes comes into play because it's trying to keep your knee joint together. All right, so that's how the ligaments work. All right, and if we turn around and look at, this is So imagine this is the front, right? There's two more ligaments here and here, which is what I'm going to talk about, right? These ligaments prevent your knee from going this way and this way. Okay, so it's kind of like stick together, all right, by the ligaments. It holds the bone there together, right? So these two ligaments are basically, all right, this one over here, it's a different name over here. Usually in the text you can actually find it as your lateral collateral ligament. Okay, it's called an LCL. And then the other side, I'm sure you guessed it, okay, it's usually called your MCL. Okay, all right. I hope the sound doesn't affect my video. Okay, so what's holding on to your kneecap, your patellar bone, is also some ligaments. All right, so over here you have your lateral patellar ligament, and then you have your medial patellar ligament. All right, so that's that for most of the ligaments around your knee joint. Okay, and if we were to get more structures in place, at the end of the day you just have your joint capsule, all right, holding everything together, all right, keeping your knee joint in place. So this tissue, it's the same. If you want to compare to your ligaments, it's actually quite rigid, right? It can be stretched to a certain extent, right? So that's it for your knee joint. Okay, this whitish thing over here is basically your bursa. You have a few of them around. I'm not going to talk about it that much, right? So then comes your muscle and your tendons, right? We know that muscle and tendons belong to one unit. Okay, so you usually have a bone structure. You have your tendon, okay, origin. You have your muscle belly, and then you have your tendon, okay, inserting into another bone structure. All right, so that's how the muscle unit functions. So when it contracts, basically it's trying to pull these two bones to each other. That's how you create movement, right? So your muscles. Let's talk about the muscles at the front first. Okay, over here you have your quadriceps. The reason why it's called quadriceps is because there are basically four muscles in this group, right? You have your vastus lateralis, you have your vastus medialis, okay, you have your rectus femoris, okay. Now the fourth one basically sits behind your rectus femoris, okay. So I'm just gonna slowly remove so that you can see there, this one here, okay. So when you see from the side, okay, it forms quite a big piece of your quadriceps muscle as well. Okay, so our muscles in the front basically is just made up of quadriceps, and that's like the main bulk of it, right? So now let's get over to your back. Okay, so over at the back you have your hamstring. Okay, depending on how you see it again, it's made up of 3 muscles or 4 muscles. I usually like to look at it as 3 muscles because the other one you really don't have to think about it so much unless you somehow or rather get that muscle injured, right? But they fall along the same plane. You should be able to find the muscle even if that happens. Okay, so this is the one I'm talking about, right? This is your bicep femoris. As you can see, it's called bicep femoris longus. Okay, the short, okay, is just behind your longus. Okay, how it's aligned is actually quite the same. Okay, so this is part of your hamstring muscle, and then you have your semitendinosus, okay, right, coming from the hip and then to the side of your knee, okay, and then you have your semimembranosus, okay, again coming from your hip and to the side of the knee. Okay, so that forms your hamstring muscles, hamstring group muscles. Okay, now more to the medial side. Okay, we have your gracilis. Okay, let me just zoom out a little bit so you can see. Okay, originating from like the inside of your groin, all right, still on your hip. Okay, and then to the medial side of your knee. Okay, and then you have your sartorius. Okay, coming from the other side of your hip. Okay, and to the medial side of your knee joint. Okay, and then you have your adductor, which makes up the bulk of your medial muscle. All right, there's actually quite a number of muscles over here, but mainly this magnus is the one that is over here near to your knee joint. Okay, so on the lateral side, okay, this is the one that people like to talk about it. Let me just zoom out so that you can see. Okay, this is that piece, that big piece, okay, that's coming into your lateral side of the knee joint. Okay, so on the lateral side, you basically only have two. One is your IT band, okay, the other one is your hamstring. Okay, but one's more on the back, one's more on the front, right? Over here, over here. Okay, so this IT band, okay, is basically like a very long tendon that comes from your hip and all the way to your knee joint. But you can't just think of it as a tendon, because we know, right, like what I said earlier on, a muscle unit usually have a tendon, a muscle belly, and a tendon. All right, so this muscle, okay, is actually called the TFL, tensor fasciae latae, okay, which is why over here in this program, in this software, they actually group it together, which is a very long name here. All right, so some people look at it separately, some people look at it, you know, together. I like to look at it together because if you have a problem around the region, you don't want to just look at it like, you know, it's just IT band, but what's happening to the IT band? It's because it maybe the TFL is also affected, right? So this is a unit that is inserting into the lateral side of your knee joint. All right, so a lot of people tend to forget, all right, but there's actually a few muscles also connected and wrapped around your knee joint, okay, and they're actually going downwards to your calf. All right, so the most superficial muscle over here is actually your gastrocnemius. Okay, so over here, right, this is your gastroc muscle. Okay, there's the medial head, and then there is the lateral head. Okay, so in a whole, basically your entire gastrocnemius. Okay, reason because it's actually crossing your knee joint. Okay, and then because it originates from there, right? So behind your gastrocnemius, you have two more muscle. Okay, let me just okay. So over here, right, behind your gastrocnemius, you have your plantaris. All right, and this thin muscle goes all the way down, right, over here, near where the Achilles tendon is, right? So another one is your popliteus. All right, so it is actually coming from the lateral side, okay, to the medial side. All right, so all right, not really the medial, but very close to the medial. All right, of your tibial bone over here. Okay, so you see this bone here, and then you see this over here. All right, so that's your popliteus. All right, okay, so there you have it. This is your knee joint. Okay, 4 bones, ligaments, your tendons, your muscle. Okay, if you like this video, don't forget to like and subscribe, right? If you have any questions, don't forget to post it in the comment section below. I'll try my best to answer them. And yes, please take care, and I will see you around. Bye bye.